Welcome back to the Ultrasound Clinic, Dr. Munir Abbasi. Here we have got a patient married 6 months ago and complaining of pain and swelling in the abdomen and secondary amenorrhea. Now let's see what is coming out. This is pelvic scan. First of all, this is uterus. This is uterine outline and endometrial cavity is slightly thickened but appears normal sized. And this is uterus. It measures approximately 5.0 centimeters, slightly small sized, and 5.0 into 2.5 into 3.0 centimeters. So this is lower normal sized. Now there is a huge cystic structure extending from the epigastric region to the, you see, pelvic region, just reaching above the fundus of the uterus. You see here, this is the cystic structure in transverse section, extending from the pelvis to the epigastric region and occupying most part of the abdomen. Even bowels have been dispelled. So this is right kidney. Above it, here is the cystic structure. This is now. Let's describe the consistency of the cystic structure. We will come later to the diagnosis. This is a smoothly outlined cystic structure containing no internal echoes, no solid parts or moiety, no septations, smoothly outlined, extending from the epigastric region to the pelvic area and occupying most part of the abdomen. Now we have to diagnose it, whether it is ovarian cyst or pancreatic pseudocyst, because sometimes pancreatic pseudocysts, they become so much enlarged that they touch the pelvic areas even. So here is the pancreas, you see, in the epigastric region, you see. Above it, this is the same cystic structure. Here is the pancreas. It appears normal, showing no kind of solid or cystic mass. Here is the pancreas, you see. Here is the pancreas. This is the head side, this is body, this is the tail of the pancreas. So sometimes cystic structures like pseudocysts, they come from the pancreatic tail to the pelvic area, but there's no such evidence. Here is the longitudinal section I'm showing you. This is the aorta. Above it, there is also same cystic structure. Now, we have to differentiate from the enlarged urinary bladder. Sometimes enlarged urinary bladder mimic with the ovarian cyst. Here is the urinary bladder. There is a borderline. This is the superior wall of the urinary bladder. Here is the again the same cystic structure. This is the urinary bladder. So both are separated by a wall. You see, this is transverse section again showing the differentiation between urinary bladder and the large cystic structure. So this is cyst adenoma, ovarian cyst adenoma. Now we have to again go for the whether it is a right or left ovarian cyst adenoma. In most of the cases, it is quite difficult to determine whether this is right or left. But in this case, fortunately, we have this is a left ovary which is visualized, showing tiny immature follicles. So the left ovary is definitely not visualized, and it is the right ovarian cyst adenoma. Now, patient has to further go for the histopathological examination to determine whether this is cystadenoma, mucinous, or serous. That would be done by the histopathology and laparotomy. After laparotomy, the patient, the ovarian cyst, this ovarian cyst will be removed from the pelvic area and should be sent to the histopathological examination, whether then we will be able to diagnose, the cystadenoma, whether this is serous or mucinous. Here is the again cystic structure, large ovarian cyst. Thank you very much.